So, Dr. Nitipat, with the latest infection today, lowest ever in 1 month, does it make you feel happy today?
It's make us, all of us, a little bit to rest for the next. I think that the second wave will coming soon, but in a controllable fashion. I think so.
I see. When you say in the controllable fashion, what would it look like?
It's mean that the number of the new cases will rise, maybe rising in gradually, without a surge of a lot of people, a lot of patients once at a time. And in the medical section, we can handle it properly. In case of no more new case, let's say less than 50 new case each day, we can handle it.
50 is the minimum, the maximum number that we can handle, right? That we can be comfortable with.
Yes, the maximum number that we guess is around 100, because for 100 new case, there may be 5 to 10 patients with severe disease that need special attention, especially in the ICU.
So you think second wave will be coming, but in controllable fashion? And how should the whole country get ready to prepare for it?
I think it's the national agenda that each sector should be participated. For the medical sector, we prepare for caring the patient who get sick from the COVID-19. For the government sector, they should evaluate it closely for the release measure in any spot, any area in the country. And also for the people sector, although we release some social measure or some legal measure, the people should still participate in physical distancing, in health hygiene, for hand washing, or wearing a mask during they go outside, or even in their home when they coming from outside.
Dr. Nitipat, what do you think we can learn from countries like Singapore, which have been hit by a second wave?
Yes, in Singapore, or even in Japan or Hong Kong, we call it because the surge of the new case is not dispersed in all area. We call it a hotspot. So in Thailand also, I think in the next second wave, there may be some hotspot in this province, in this area, in this sector of Bangkok, something like that. And if we have the mapping of all area in Thailand, and if some area have some more new case, we can attack that. We call it a targeted measure or targeted screening in some area. And with this measure, I think we can control the number of the new patients in controllable fashion, as I mentioned earlier.
Do you mean Thailand should try to pursue more active case finding, like what has been done recently, to try to find more new cases as much as possible?
I don't think so. We called it targeted screening. We are not a prosperous country like Germany or South Korea, but we have a strong system in the community. And if we, as I said earlier, if we have some hotspot that a lot of new case, we send our health volunteer or the participation from the people sector to try to restrict the spreading of the disease, and then we screen just only in that place. We do not do we should not do the active screening, widespread screening in the community, because it's caught a lot.
Dr. Nitipat, what kind of areas or communities that have the potential to become the so-called hotspots?
Yes, if you look at the figure during the past 2 or 3 weeks, the number of the new cases usually in the same family, in the same cluster. And as in the last group of patients in Siriraj Hospital, there are 4 patients from one family in Bangkok. It means that which area that the people living crowded, or even in such as in Samut Songkhram, there's labor from Burma or from Cambodia. That is a hotspot. Like in Singapore, there's a foreign labor in Singapore. That's the outbreak. So if we target them in this group, provide them the medical checkup, screening, education, and or even social welfare or something to make them live easier, it's maybe we can control it.
And should this targeted screening should be done as early as possible?
Yes. If we have figure which area may be the hotspot in the future, we should speculate that area and maybe have a screening process.
And
when you talk about the second wave, is it something that is a certainty that it will definitely happen, or is it something that we can do something to prevent it from happening?
I'm not sure, but from the epidemiological point of view, there should be a second wave. But the second wave may be, in my view, it should be less tough than the first wave, because during the first wave we didn't. We prepare. We have no knowledge, no proper place to care the patient, no test, no drugs. But now the lesson that we learned from the first wave in the medical section, we think we have we prepare for the second wave properly, but the one thing that is the uncontrollable factor is the rainy season. I'm just concerned about the rainy season, that maybe it's maybe potentiate for the virus to spread. Or when
it will be a contributing factor, you think?
Yes, and maybe it will have, when we have some patient that get sick from other viral infection, that maybe interfere with the doctor when they care for the patient, whether it's COVID or whether it's another respiratory pathogen, something like that.
With the warning of second wave, CDC of the US has already warned that the situation will probably be worse than the first one. But for Thailand, you think second wave will be much easier?
In my view, I think when we look at after we have the first wave, the peak of the first wave is allowed at the end of March or the earlier of April, and then when we have tough measure in the government sector or in the public sector, we can control the disease quite effectively. And I think that measure that we do is we go in the right way. And I think the lesson learned from the first wave, we can use it with more beneficial in the second wave if we encounter it.
And what else should What
Go
else
ahead.
should Thailand do for medical personnel in terms of preparation, personal protection equipment, and what are the other equipment that Thailand should try to prepare for?
And in the medical sector, now we like other sector of service. Now the medical service is trying to resume some medical service for the non-COVID patients. So we must divided our resource for resume the caring of the non-COVID patient. And we also design the new normal medical service for COVID patient or suspected COVID patients. And this consume a lot of protection, personal protection equipment or PPE. Let's say the gown, especially the gown and the mask. And now it's the bad news for Thailand. The raw material for producing the mask or the gown for protection will be tough during this month. So now we in the step of we try to produce, we call it reusable PPE in Thailand, and we try to gather all the participants from government and private sector, and also from the many companies with the know-how to become we can standing in our own supply in our country.
Dr. Nitipat, we all know that Thai people are very anxious to go back to their normal life, right? After more than a month of shutdown. And as you can see in Bangkok today, it looks like a normal Friday now. People, the streets are full of cars, traffic jams again. So are there any things you want to tell us, some kind of precaution that people should be aware of so that we will not contribute to a quick return to, the bad old days when we have to be confined to our houses again?
I think it's when we suppress something for a long time, when we just release it, there may be some swinging effect or the yo-yo effect, and we must see in the next few days or week whether the public or the people still conscious of preventing measure. And I think preventing measure is very, very significant in our country to control the disease. We are not the rich country. We have limited resource. The only weapon that we can use to combat COVID-19 in our country is the participation of our sector for the using the social measure and legal measure to control the spreading of the disease more than the strategy to active screening and try to know the new case everywhere, something like that. I think our strong point in our country is a system in our country that we will combat this disease.
I see. The public participation, I think, is very important.
Yes, I think.
And in terms of timing to see ease of the lockdown at the moment and coming on Sunday, is it about right? What concerns you the most? Is it the right path for the country?
I think so, but the effect of the releasing measure will be see in the next 7 days after this. And if the number of the new case begin rising in the not in a controllable fashion, I think the authority must do something, and the people also remind that it's the temporary release, it's not the permanent release.
I see. So we are entering the stage known as the suppress and lift, right? We suppress when there are cases, and then we lift it when things get better. Okay.
Yes,
So
yes.
let's see how the lift part will work out in the next 14 days.
Yes, yes, and I think the system of the country to to project which area is the hotspot. The data that we have now, the platform, and it's quite effective to generate the report to the authority to make a decision whether to go on the release or even step back for the tight control. It's reasonable.